Good afternoon, everyone. This is Michelle Ekstrom at the National Conference of State Legislatures. I'm pleased to bring to you another webinar in our series of webinars that we've been doing around our International Education Study Group work and our report, No Time to Lose, How to Build a World-Class Education System State by State. Over the past couple of months, we have been digging more deeply into our first element of success for world-class education systems, and that is that children come to school ready to learn with extra supports, and extra supports are given to struggling students. In our first webinar, about a month ago, we learned about the work that was going on in other countries, and we had experts join us from OECD. During this webinar, we will have experts from the Learning Policy Institute and West Virginia Senator Robert Plimo, who will give us a closer look at 4 states that are implementing early learning policies and practices that reflect what we know matters from top-performing countries. Marjorie Wexler and Madeline Gardner from the Learning Policy Institute will join us, and then we'll hear from Senator Plimo. So we'll begin with Marjorie and Madeline.
Great. Thank you very much for the opportunity to join you this afternoon. This is Marjorie Wexler, and I'll be speaking for a little bit and then pass it on to my colleague, Maddie. I think most of you are familiar with the Learning Policy Institute, but for those who are not, we are a nonprofit organization that conducts and communicates high-quality research to improve education policy and practice, and our mission is to enhance learning for each and every child. And one of our key topic areas is early childhood learning. So earlier this summer, the study group heard from the OECD about some of the top-performing early childhood systems and the elements that make them high quality. And today, we are going to take a close look at 4 U.S. states that have already begun to implement some of those practices in their own efforts to build top-notch state pre-K programs. And our goal is to talk about the practices present in those top international performers and provide a sense of what those practices look like when applied in the U.S. But before we dive into that, I want you to think about what high-quality early education is. So imagine this. Imagine 18 4-year-olds gathered in a circle with 3 teachers sitting among them. One teacher built a bridge that looked similar to this one you see on the slide, but instead of blocks, one by one, she put little plastic bears on the bridge, each time asking the children if they thought the bridge could handle one more bear or not. Can you imagine the gasps of anticipation as she placed each bear on the bridge? Finally, and it was the 16th bear, the bridge collapsed to shrieks of delight. The teacher did the experiment again, but the second time she folded ridges in the paper and had the students predict if the second bridge would be able to handle more than 16 bears or fewer. So for those who need to know the answer, it held 23 bears. The lesson ended with the teacher telling the kids that there were lots of materials waiting for them outside so they could try building their own bridges and doing their own experiments. So this was a real lesson that my colleague and I observed at Brown's Early Learning School in Durham, North Carolina. So just think what a rich lesson that was, right? There was prediction, counting, experimentation, there was hands-on learning, there was one teacher for every 6 children, and I could go on about the merits of this one 10-minute lesson. And we know that there are states working to ensure that all of their early learning classrooms are as high quality as the program at Brown. So that's what we're going to be focusing on today. Maddie and I will be sharing the findings of research that we conducted at Learning Policy Institute to understand how states can design, fund, and manage investments to assure high quality preschool. So in the next few minutes, I'm going to give a quick overview of the methodology we used in this research, and then I'll briefly introduce each of the states that we focused on. After that, I'll turn it over to Maddie to talk about the lessons we learned about the strategies for building high-quality early education systems. And we'll cover issues like program standards, support for teachers, and funding. And finally, we're lucky to have Senator Bob Plymel of West Virginia to discuss his experience as a legislator working to enact legislation in support of high-quality early education. And then we'll have some time for questions and answers. So first, I'll give a quick overview of the research that's informing our presentation today. We conducted case studies in 4 states: Michigan, West Virginia, Washington, and North Carolina. We really wanted to understand the ins and outs behind the design and implementation of their preschool programs. We chose these states because each one has research showing it has made a difference in children's outcomes. Also, they all have high ratings on the benchmarks established by the National Institute for Early Education Research. Further, they all have been able to expand their programs without sacrificing quality, and they're very diverse in terms of their geography, their demographics, and the political context. So I want to let you know we chose these 4 as examples, and we know that there are a lot of other states who are doing great work, including some of the states represented on the line today. Our case studies included interviews with 30 or more individuals in each state. They represented policymakers, state program administrators, local program administrators, teachers, parents, and others. We visited early education programs in each state, and we reviewed a broad array of documents such as program manuals, evaluations, and court decisions. And while we're mostly focusing on preschool today, we'll sometimes talk about other early childhood programs like child care subsidies, because sometimes the programs are very intertwined, and to really understand one, you need to understand the other. So as I said earlier, these 4 states are very diverse, and not just in terms of their geography and political context, but also in the scope and scale of their preschool programs. So this chart shows, for example, the wide variation in the proportion of 4-year-olds served. So Washington State, for example, serves only 8% of its 4-year-olds, but that program is designed specifically to target preschool to the state's poorest families. And West Virginia, in contrast, is serving 75% of its 4-year-olds, as West Virginia offers a universal program, meaning that anyone, regardless of family income or where they live in the state, can participate. One shared feature of these preschool programs is that they all use a mixed delivery system, meaning that state pre-K is offered in a variety of settings, from public schools to public and private child care centers and sometimes Head Start programs. And we're going to return a little later to some other similarities in the way that these states approach high-quality preschool. But each state offers a rich story in and of itself. So I want to give you just a very brief taste of each one. So Michigan's state-funded preschool program is known as the Great Start Readiness Program. And since the program's beginning, Michigan has really focused on quality. So the state has had standards for early education since 1971. So that's long before the standards movement really took off. And they have standards for structural elements, such as class size and teacher qualifications, and they have standards for elements such as how teachers and students interact. They regularly measure program quality against those standards using observational assessments, and they provide intensive on-site coaching to all pre-K teachers to help improve their practice. And multiple times over the years, since 1971, they've revised their standards and improved their systems and their improvement systems, always keeping that quality at the center. In North Carolina, there's 2 notable early childhood programs that I want to introduce. The first is Smart Start. So these are public-private, nonprofit partnerships in every county, and they do things such as assess community needs, and they coordinate early education services locally. So these Smart Start agencies often act as a one-stop shop where families can go to access all early childhood programs and services available in a county. Smart Start also may run programs like parenting classes or child care quality initiatives. And Smart Start initially focused on birth to age 3, and was typically available to all members of the community regardless of their economic situation. And then a few years later, the state developed a state preschool program called NC Pre-K. And the early childhood infrastructure created by Smart Start allowed the pre-K program to get up and running easily. North Carolina also was a pioneer in quality rating and improvement systems, also known as QRIS. And these systems identify elements of quality on which programs are assessed and establish tiers or levels that identify progressively higher benchmarks. These systems provide a basis for accountability and for program improvement. Washington's preschool program is the Early Childhood Education and Assistance Program, or ECAP. And as you saw a few slides back, it's a relatively small program designed to serve children from the state's lowest income families. Now, ECAP was modeled after Head Start, meaning it takes a whole child approach by providing extensive wraparound services such as medical care, dental care, and social services. And recently, the state began efforts to expand access to high-quality early learning by bringing home-based child care into the state's quality rating and improvement system. So essentially, they took that quality rating program that was designed for preschool and started using it with subsidized child care providers too, which means that those subsidized child care providers must offer strong educational programs in order to continue receiving state funds. And to raise the quality of that child care up to the level of the state's preschool program, the state is providing intensive coaching to child care providers. And that brings us to the fourth state, West Virginia, and the West Virginia Pre-K program. So as I mentioned before, this is one of the few universal preschool programs in the nation. And that's a point of difference between the U.S. and some of the OECD countries that you heard about in June. It remains uncommon in the U.S. for publicly funded preschool programs to serve a large proportion of children. But in going universal, and we'll hear more about this later, West Virginia benefited from several important design choices. So for example, the legislature allowed 10 years for the rollout of the program, which enabled local districts to build capacity and the infrastructure for the program. And also funding for the preschool program is integrated into the K-12 funding formula. So compared to many other states, program funding is relatively stable. So the full case studies go into great detail on each of these states, but now Maddie is going to discuss some of the trends that we saw across them.
Great. Thank you so much, Marjorie. And hello, everybody. As Marjorie said, my name is Maddie. So we also looked across these four states for cross-cutting lessons and themes. And I think this is where you'll see a number of similarities between what we found in this work and what you all learned about top-performing countries in June. To start, one overarching lesson is that there's no single road to starting, expanding, or improving early education at the state level. Each state truly follows its own path. But there are factors that contribute to success. And for today, I'm going to talk about three big areas that impact success: program quality, workforce development, and program administration and funding. And as I go through each one of these buckets, I'm going to be giving you some examples from the cases that Marjorie was describing. I'm not, however, going to give you an example for every one of those four states on every one of these points, or we'd be here for hours. But know that these were cross-cutting findings that did not come from just one single state, but instead were demonstrated across a number of states in this study. So to start, these states have all invested in strategies to support program quality. Each, for example, has developed program standards and assessments to support quality early learning experiences. So each of these states has standards for everything from class size and teacher-child ratios to teacher qualifications, what the OECD presenters referred to in June as structural features of quality. They also have standards for the ways that teachers talk to and interact with children or process quality. And in addition to setting standards, they also have assessors who conduct classroom observations to gauge how classes are faring across all of these indicators. 3 of the states that we examined, Michigan, North Carolina, and Washington, also use quality rating and improvement systems, or QRIS, to reinforce their quality standards for pre-K programs. So as Marjorie described a little bit earlier, QRIS help to support program improvement by both defining expectations for quality and providing assistance to programs in reaching those goals. Often, QRIS can include assessments of both those structural features of quality and also process features. Another way that these states prioritize quality in their pre-K programs is to link program funding to ratings from QRIS or other types of program assessments. So we can consider North Carolina, for example. North Carolina is one of just a few states across the country that integrates its child care licensing system with its quality rating and improvement system. And what that means is that it requires all of its early childhood programs, including subsidized child care and preschool, to participate in its quality rating and improvement system. And in North Carolina, its subsidized child care providers must maintain at least a 3-star license out of 5 stars to continue receiving subsidies. State preschool providers must maintain a 4 or 5-star license to participate in that program. And finally, these states maintain quality by having local supports to help meet the needs of their diverse communities. We observe that state agencies really can't do this on their own. Administrators closer to the programs, such as those in county offices of education, often have more capacity to manage and monitor programs and to address regional needs. So, for example, West Virginia Pre-K was specifically designed for strong local control. In each of West Virginia's 55 counties, there is a local collaborative team that has the autonomy to adapt the pre-K program in certain ways to meet their needs. So as you can see on this slide, these county teams include a myriad of local early education stakeholders, everyone from the County Board of Education, preschool special needs programs, Head Start, child care, parents, and others. And these teams are making decisions about all sorts of issues, ranging from the preschool calendar and curriculum selection to enrollment processes and the subcontracting of program administration. Next, all 4 of these states place heavy emphasis on boosting the quality of preschool teachers. They all set high standards, requiring their lead teachers to have a degree with an emphasis in early childhood education, child development, or a related field. So North Carolina, for example, has particularly high standards. There, the state requires all preschool teachers in their state pre-K program to hold both a bachelor's degree and a birth through kindergarten teaching license, and that standard applies whether those teachers work in public or private settings for that state pre-K program. As these states required more from their teachers, they also gave their teachers several years to meet the increased requirements, supporting the current workforce in meeting the new bars that they have set. As you heard in June, many top-performing countries strive to support teachers with ongoing opportunities for learning. These 4 states also do that. They make training accessible to teachers by offering courses regionally, in community colleges or perhaps county offices of education, or sometimes online. So for example, West Virginia has had an apprenticeship program where preschool staff remain employed in the center that they're working in, while also receiving mentoring and taking classes at the state's community and technical colleges. West Virginia has also developed online associate level courses that are freely available to teachers who are striving to become associate teachers in the pre-K program. We also saw that these states encourage teacher advancement through scholarships and salary supplements. So North Carolina, for example, developed the Teach Early Childhood Scholarships to support its teaching workforce. In that program, the state awards scholarships for books and tuition in exchange for a commitment to remain in the field of early childhood for a set amount of time. Recognizing the importance of compensation in building a strong workforce, North Carolina also developed the Wages program, which it runs in concert with its Early Childhood Scholarship program. Wages supplements teachers' salaries based on both their level of education and their length of tenure in their role. And part of the reason we mention these programs is that other states have since begun using them too, perhaps including some of yours. And these initiatives can be great, but though they can begin to chip away at the compensation challenges that are faced by this workforce, many of the states we talked to also acknowledge that preschool teachers are still relatively underpaid. finally, the states that we studied support the workforce by providing on-site coaching. Marjorie mentioned this a little bit earlier in talking about Michigan, for example. In that state, they provide coaching for all of their pre-K teaching teams. The state's coaches are all experienced teachers who hold master's degrees and have relevant experience in the classroom. Every pre-K teaching team receives a monthly visit from one of these coaches throughout the school year, which is very much not a light touch. And I think these examples help to demonstrate the investments that these states have made. As Stephanie Fanhole, former president of the North Carolina Partnership for Children, said, people forget that you can't build an industry and expect it to be fine without investing in the people who work in it. Implementing all these important elements of program quality requires states to invest, and we saw a number of ways to approach program funding across these 4 states. Some states have leveraged short-term funds to make key investments in their early learning systems. These short-term funds often are used for building program infrastructure rather than funding preschool slots or ongoing services. So for example, Michigan, Washington, and North Carolina all used federal Race to the Top Early Learning Challenge grants to develop kindergarten readiness assessments and to improve their quality rating and improvement systems. Developing a public-private partnership is another strategy to bring in dollars supporting early education. So at Thrive Washington, for example, is a public-private partnership that coordinates government agencies, businesses, and nonprofits that are working on early learning issues across Washington state. The partnership also helps to administer Washington's home visiting program, blending federal, state, and private money to support that effort. But what really makes these state pre-K programs work across these 4 states is the strategic combination of funding from a number of different sources, federal, state, and local. It typically took dedicated state dollars combined with these other funding sources to expand access and enhance program quality for state pre-K. So you might have a classroom where some students are funded through the state preschool program and other students are funded through Head Start. Or you might have a classroom where children are there for the full day with state preschool dollars paying for that morning session and Head Start paying for the afternoon. This slide shows the multiple federal, state, and local funding sources that these 4 states used to fund their state preschool programs. So starting on the left, federal funds come out of several departments. From the Department of Health and Human Services, you have Head Start, TANF, and child care funds. From the Department of Education, you have Title I and IDEA, and as I mentioned on the last slide, sometimes other grants as well. State funds, too, can come from a variety of sources, such as state school aid, the general fund, or lottery revenues. And local funds are much less consistent and can vary quite substantially, even with a single state, but may again come from a variety of sources. And as I discussed on the last slide, states often have other sources of funding, including private dollars, that could be used to help plan for or build quality pre-K. So as you can see on this slide, often funding streams that are traditionally thought of as education dollars and those that are typically considered health and human services dollars can in fact be woven together to serve more families with higher quality services in pre-K. However, because each program has its own reporting requirements, this combining of funds can sometimes be difficult. For example, teachers may have to report data for each program separately and not necessarily the same data. And this is an issue that states and local programs continue to grapple with. Despite this challenge, however, all 4 of these states work across the boundaries of programs and funding streams. And one thing that can make that collaboration easier is to coordinate the administration of early learning programs. This coordination can also create a more seamless experience for children in these programs as well. So one way that states have promoted coordination is by putting all children's services under one umbrella. So Washington, for example, created the Department of Early Learning, which oversees most of the state's early childhood programs, including its preschool, child care, and home visiting programs. Putting all of those programs within one administrative structure enables the state to coordinate among them, and it also positions early learning as a political priority since the department is a cabinet-level agency. Michigan similarly put early childhood programs together in one administrative body that's housed in the Department of Public Instruction. North Carolina did the same, but instead housed the agency in the Department of Health and Human Services. In West Virginia, the state created a collaborative structure that required Health and Human Services and the Department of Education to work together without formally merging any of those departments. Another way states are improving coordination, especially between preschool and kindergarten, is by developing more robust early childhood data systems. So in West Virginia, for example, they've created a data system that enables pre-K and kindergarten educators to share relevant child data to help smooth transitions to school and promote collaboration across the pre-K program and K-12 schools. And finally, these states are improving coordination by aligning curriculum and assessments. Washington uses the same child assessment tool for both preschool and kindergarten classrooms to help facilitate transitions to school and give pre-K and kindergarten teachers a shared language. Though these efforts to align instruction across grades are encouraging, it's also important to ensure that the type of instruction that children receive continues to remain appropriate for the developmental stage. And that's part of why having that really skilled and well-supported workforce is so key to the quality of programs. However, we know that creating a high-quality state pre-K program is very complex work. There are questions of how a state could get a program started and how it can build momentum given tight budgets and competing priorities. And that is something that Senator Plymel has a lot of experience with. So I'm going to go ahead and hand it back off to Michelle, who can introduce him to share a little about the experience in West Virginia.
Thank you, Madeline and Marjorie. This was really helpful. And now we are going to hear from Senator Plymel, who will discuss his role as a legislator and the work that they're doing in West Virginia. Before we do that, though, I just wanted to remind you that you can type your questions into the chat box. So please do so, and then as soon as we are finished, we will pose those questions to our speakers. Senator Plymel?
Thank you. It is my pleasure to be here. I will go and give a little history of what happened in West Virginia before I get into some of the crux of how we came about the funding model. So the policy side of this, I was the vice chair of both Health and Human Resources. I was chair of pensions, vice chair of Health and Human Resources, and vice chair of education when this policy was coming about. Senator Jackson in West Virginia was the education chair and the chief drafter of the policy. So he gets a lot of credit for drafting the policy to get this first implemented in the 10-year plan. Later, I became the chair of education. And that was in 2002 when I became the chair of education, when we were in the midst of trying to work out a lot of the details related to the implementation. There were three organizations that Senator Jackson and myself did not miss a meeting on early childhood. And we were in session 60 days. We have interims every month. At that time we did. And we utilized those interims to meet with the constituent groups. But those three organizations we worked with were SREB, NCSL, and Education Commission of the States. So from an administration standpoint, we looked at, it was not conceivable to try to bring this under one organization. So we got a joint effort, and we put a joint effort together from an administrative side with the Department of Health and Human Resources and the Department of Education. Now, I will tell you, as the chair of education, there were many times and many months that we met that I felt like a convener, a referee, a facilitator of compromise among providers such as the private sector, the providers, the Head Start, state and school district pre-K, and since we were in a very rural state, a combination of several collaboratives. So the collaborative model that was articulated previously is very important to understand that this collaborative model, we required in this collaborative model that at least half of their classrooms requires the county boards to contract with community partners. Maddie outlined how the structure of the collaborative worked on a county level. You know, our guiding principle when conflict or disagreements would arise is what is in the best interest of the children we are trying to serve. And as long as you use that guiding principle, we could get all parties to finally come to the table to compromise. These things included such minimal things as a 6-foot fence being required by Head Start. Well, if that's required by Head Start, why wouldn't we have the same requirement for our pre-K classrooms in the public setting? So we had a major transportation issue, and we worked through all those things as well. We also came up with several oversight and implementation mechanisms. One of those, and remember, we had staff for us that really came up with some great acronyms. PIECES was one of those. It was Partners Implementing an Early Care and Education System. That later transformed into the Early Childhood Advisory Council. We met with them every month to go over what their issues were so that we would stay on that and we could actually resolve them without having to go into session or anything like that. So the Early Childhood Advisory Council started in 2010, and that fulfilled the Head Start's mandate for a state advisory council. So we tried to meet everybody at the middle and where it needed to be. Let me mention a couple people that were really instrumental and essential in our success. Kay Tilton from the Department of Health and Human Resources and Kathy Jones from the Department of Education. They were not only pioneers and leaders in shaping the program, but were able to take the policy that we put in place and actually make it work from a bureaucratic and very many different things that were happening. So no matter how much consensus we were able to build in the provider community, we did have some negative forces that existed in the legislature. So in 2002, when I became chair and was involved prior, as I said, as the vice chair of education with policy and early funding priorities, in 2003 and 2004, the differences between the House and the Senate became very, very stark and very outlined of who wanted what and what was happening. In 2003, this was my first year as chair, even though I fought this effort greatly, it ended up being the way that we were able to come to a compromise and somewhat of a compromise. It's something that we passed, that we got the governor's support as well. But in the House has separated the funding for pre-K from K through 12. They did this not with the greatest intentions. They did this in West Virginia to show that, look at all this growth we have in pre-K, and we can't afford this kind of growth. And I don't really want to get into the weeds of too much in funding, but in the state of West Virginia, we have a school aid formula that pays on a per-pupil basis to the local communities. Now, remember, we're a state-centric where the funding comes to the state and we disperse it down through the school aid formula in West Virginia. So in October 1, we have a head count, and that head count would then provide the funding for the next year's budget starting in July of the following year in that fiscal year. So the state had several pockets of growth. Now, growth, I'm going to be saying that is an increase in enrollment. That increase in enrollment was predominantly in the Eastern Panhandle next to Washington, D.C. And it was primarily in K through 12, not in pre-K. The House Finance and Education chairs were from the Eastern Panhandle and were attempting to come up with a solution so their districts would get funding in the year they experienced growth, not the following year. Several attempts through 2000 to 2003 were made to address this issue. None of them were successful. And as you know, in the political realm, when a new chair comes in, even though I had chaired other committees, when a new chair comes in, such as I did in 2002, this was going to be my first test of will and skills. I'll just say it that way. This particularly came to light during the 2004 session. We had, in the Senate, had been preparing several formulas to address the growth in student enrollment in these growth areas as they wanted to in the Eastern Panhandle, while also paying for the expansion of our pre-K initiatives. The meetings with the House and Senate leadership were very intense and divided. The House supported a bill not recognizing pre-K and growth. And as usual in the legislative process, as the deadline approaches during the end of the session, the issues and priorities surface, sometimes not in a good way. It was clear that the House Finance and Education chair wanted a solution to the growth problem for K through 12 only. Knowing this, we came up with a solution in the Senate to address the pre-K funding as well as the K through 12 growth or increased enrollment issue. Simply stated, my approach was growth is growth, and pre-K was not only good policy, but it was growth or increased enrollment as well. So we originated a bill in the Senate that addressed both issues in Senate Bill 604 to establish a mechanism to project the growth in each county. So we had a formula that the State Department of Education came up with that could identify growth factors and actually estimate that. And to project the growth in each county, we could allocate 65% of the money that was needed for that year that they were having the growth, and we set aside $10 million in the school aid formula for this to start it the first year, and then every year after they had to come up with that as a part of the formula. Within the first, so September 1, they would get 65% of the money in the first month of each school year, so they would get it actually within the first 2 or 3 weeks of school. In the Senate, this bill passed 34-0. The other aspect of this is after the October 1st head count and the validation of the true enrollment numbers, that was done by December 15th. What we did, whether it was 35% or if we had inadvertently paid 70% instead of 65%, the balance was given to the counties on December 31st. So at the end of the session, in the last 2 or 3 days, the House insisted on passing their bill, and I held very firm. I will have to say that. I had a lot of people try, even in the Senate, that were Eastern Panhandle representatives, to try to get me to give in. But I knew at the end of the day the House needed the growth formula for increased enrollment on K through 12. That was something they needed to take home with them to say that they've done that after 3 or 4 years of failure. So the bill, this was in the last 2 to 3 hours of the session. On a Saturday, we got the House to agree to our bill totally and pass it back over to us, where we had about an hour and a half to spare before the end of the session. And that was the policy that led to no longer having the issues related to funding for universal pre-K. I also would want to mention that there's two people that, no matter how you would do this, Steve Payne, who is now the superintendent of schools, was the superintendent of schools during that time. He called himself 1.0 then. Now he calls himself 2.0. And with Steve's support, he was fantastic on this. There was a person that they brought in that was at Marshall University running a pre-K STEM initiative called Clayton Birch. And Clayton Birch is well known for his pre-K through 3 and literacy and school readiness and everything. When he came to the department, Clayton Birch made it so easy to be supportive of the pre-K that he was very instrumental in what we have now. So that's the story in West Virginia, and I'll be glad to answer any questions that anybody would have.
Thank you so much.
Thank you so much.
That's really helpful. We really appreciate you sharing the story in West Virginia in great detail. I don't know if any of us have really heard that before, so that was super interesting and helpful. And as a reminder, if you have any questions for Senator Plimal or for our speakers, you can ask them in the chat box. We do have a question that has just come up, and it is from Representative Takumi in Hawaii, and he says that the challenge in Hawaii is that the NEA affiliate asserts that the only way to ensure quality is to have a public preschool system, and that a private-public partnership does not accomplish this. Is there another state where the teachers union have made similar claims? Is there anyone on the line who has experience with this? Anyone from LPI or Senator Plimal?
This is Marjorie. Oh, sorry, Senator Plimal, did you want to address that?
Yes, to Roy, we did have, issues. They were at the table when we were discussing these monthly meetings, and as long as we increased the pay and kept the quality where it was, they initially were not as supportive of this program or our approach, but they became that way when they saw that we were serious about the quality, we were serious about the pay and the requirements of the people that would be administering the quality universal pre-K. So we did have some opposition to it, but sitting down with them on a regular basis, which we did all the time, I think we finally, won them as converts.
Marjorie, did you want to add to that?
I was just going to address the issue of educator quality in general, because as Maddie said, all of these states really did pay attention to the quality of the workforce, and I know that's a big question in the field. Do you need a bachelor's degree? Do you not? While there's research that's still being done on that issue, we did not only these case studies, we've done a comprehensive literature review on quality elements, and really making sure that your workforce does have the professional knowledge and skills is important. You have research such as that coming out of the Transforming the Workforce, which was done by the Institute of Medicine and National Research Council. and they recommend that lead teachers have a bachelor's degree. The programs, many programs around the country that have a track record of success, such as the ones we talked about today. New Jersey requires a bachelor's degree, Boston, Tulsa, Oklahoma. Looking at those lead teachers, they do have those advanced degrees, but important, I don't want to get into that discussion, but importantly, they have a specialization in early childhood education. So it's really important that the teachers have specialized knowledge about child development, about things such as instruction for young children, so that they can both feed the academic development of the kids and the social and emotional development of the kids, and provide those classroom environments and those engaging interactions that create those benefits that we see for early childhood education. But I also want to point out this is not just an issue of the degrees that teachers or educators come in with, but it's also the supports that are provided to them so that they have time to work with their colleagues and plan good environments for the children so that they have the compensation that makes them want to stay in the profession, so that they have support so their jobs are not, we find stress to be a big problem with early childhood educators. So when we talk about the workforce for these kids, it's actually a very complex issue. So I know I just threw a lot of things on the table, but it's
yeah, and this is Maddie from LPI. I would love to just build a little bit on what Marjorie is saying as well. I mean, I think all the things that Marjorie's just laid out are so important. And one thing to keep in mind for state pre-K is that, in some states, there might be sort of standards and expectations that those kinds of supports, those kinds of training and qualifications are shared by teachers sort of no matter which setting they're teaching in for state pre-K. But in other states, there's variability across setting. And so I think one thing that you could be attentive to sort of from a policy perspective is, to what extent are there perhaps disparities in the conditions or expectations around teaching, depending on where folks are working in your system.
Thank you, everyone. That was really helpful. This question was actually posed earlier also by Senator Elliott, the question about the quality and the experience of the educators. She mentioned that she was going to have to hop off the webinar early, and so you ended up answering her question anyway, and we can follow up individually with her. And I know just from my own work on teaching policy, a lot of the challenges are very similar and maybe even exacerbated in the early education world, and in particular because of the compensation issue. So a lot of what makes for a good K-12 educator also makes for a great early educator as well. I had one other question. A lot of what we heard about high-performing early education systems dealt with the fact that they are so well connected in these high-performing countries to the K-12 system, and that these countries don't experience the gaps within K-12 for those who have had high-quality early learning experiences in the same way that we do in the United States. And a number of the experts that we talked with just discussed the fact that oftentimes if a child has been exposed to a really great pre-K program or early learning program, that does not continue on in K-12. And I'm wondering if you can speak to that, about what policies and practices are really important to ensure that we are continuing to provide the students what they need in those early years, like K through 3, so that the students don't lose the advantage that they've received from early education.
Great. This is Maddie from LPI. I think that's a really important question, Michelle. And you started, I think, talking a little bit about part of the why that's so important, but one of the things that's really coming out in the sort of effectiveness literature around pre-K in the last couple of years is the really important role that alignment with pre-K and the other early elementary grades may have in sustaining the kinds of gains that kids see. You know, they enter school more prepared because of a pre-K program, but can they sort of continue to build on those gains? It looks like probably has a lot to do with sort of the quality of the instructional experience that they're having as they enter school and the alignment of that experience. And I think, few if any states have really figured that out in the U.S., but across all 4 of these states we know it's something that they're thinking really hard about. I know Senator Plymel mentioned Clayton Birch and some of the work that's been done in the Department of Ed in West Virginia. There's been a ton of work in West Virginia around the concept of formative assessment and what that looks like, of aligning those curriculum and assessments between pre-K and the early elementary grades. And as I mentioned a little bit in my presentation, in using data strategically as a tool to help foster that alignment and have a common language and a common starting place. We saw that example in the state of Washington as well in developing that kindergarten readiness assessment that can help those kindergarten and pre-K teachers put a similar lens on learning and children's development in that span. Part of the challenge can even be that in pre-K and kindergarten, the teachers might be using different language to refer to the same things. And so having those kinds of assessments and those opportunities for joint learning across pre-K and the K2 sort of space or K3 space are some of the things that we've seen states trying to try and really build that P3 continuum. And yeah, our states were certainly aware of that challenge and I think all moving forward to try and make sure that they're providing that kind of quality into elementary school.
This is Senator Plymel. I would tell you that you've hit that exactly right in terms of the continuum. And there is, in West Virginia, they call it one voice, one focus. And Clayton Birch has given presentations on this, but there's 3 slides that I could send out that really address that and how that continuum is implemented in West Virginia.
That's great. And this is Marjorie. The one interesting tension between the links between the pre-K and the early elementary years that you hear from a lot of on the pre-K side is a concern that inappropriate developmentally practices don't get pushed down. That in fact so that as you're creating these linkages, that we keep in mind where the children are developmentally and make sure that what we're providing, the supports, the learning environments, the other types of support remain developmentally appropriate for young children. So I know that there was a concern that don't take your assessment policies and push that down to kindergarten, but let's understand, let's do assessment to understand where children are and provide the appropriate supports. And let's actually conduct assessments that themselves are developmentally appropriate for young children. So that's just one word of caution or something that needs to be considered when you are creating these very important links across the span pre-K through grade 3.
Well, thank you, everyone. This has been a great discussion. Just as a reminder, we are recording the webinar, so it will be archived, so you'll have access to it, to these slides, and to this presentation. And if you are interested in following up with any of our speakers, you can certainly send an email to me or others at NCSL, and we can connect you to them. I also wanted to mention that at any point you can always reach out to NCSL to get your questions answered. Matt Wire is our early education expert, and he has produced a number of really great resources and guides for state legislators, and he has a couple of ongoing advisory groups of state legislators who help us think really deeply around early learning. So if you ever have any questions, or if you want to be more involved with us, or just need additional information, I would encourage you to reach out to Matt and to also visit our website, and I provided the link to that on the webinar as well. Thank you so much, and we will continue our webinar series, continuing to focus on early learning later this year. There's a groundbreaking study of other countries, a deep dive into what other countries do around early learning that will be coming out later this year, that's being led by Dr. Lynn Kagan, and as soon as that research is released, we plan to have another webinar in this series, so stay tuned for that. And thank you for sharing your afternoon with us.